My name is Jacqualyn Dareus. I am a Troy nursing student from the RN to BSN program, and this will be my full head-to-toe assessment on a 28-year-old married male in a home setting. So we will be doing a video recorded assessment. You said that was okay earlier. I will try my best to keep you covered as much as possible, but I will ask you to remove your shirt at some point, and then we will put it back on for you. And he appears to be, clean my hands, he appears to be in general good health. He appears to be the stated weight of 390 pounds and a height of 6 feet and 4 inches. His color is appropriate for ethnicity. Hygiene is appropriate. He keeps his hygiene up. Don't smell any odors or anything coming off of him. His fingernails are clean and well groomed. He's dressed appropriately for the occasion and also for the climate. Sir, are you having any pain today?
No.
Okay, good. We will start our assessment with palpation of the head. We're going to go from head to toe, so we'll start with the head. Palpating the head. Going to be checking for symmetry, checking the scalp for any lesions. None appear to be there. Going to be checking your lymph nodes as well. Could you open your mouth for me? Alright, and rotate your jaw. Alright, mild crepitus is there. We're going to be checking the face for symmetry, just making sure you're even on both sides. Going to inspect your eyes and your eyebrows and eyelashes, the outer structure of your eyes. And check the conjunctiva. They're all pink. The vessels are dark red, have brown discoloration on the eye, which is appropriate for his ethnicity as well. Going to be checking the cornea, make sure there's no cloudiness there. If I had a Snellen R chart, I would place it 20 feet from the patient and assess bilateral eyes and together to find out what his vision acuity is. Do you wear glasses, sir?
Sometimes.
Okay, so the client does wear glasses sometimes, so he does go to the eye doctor regularly. We're going to be checking your eyes to see how you reflect to light. So keep your eyes open for me. Open your eyes wide. Alright, other side. Alright, could you raise your eyebrows? Close your eyes really tight. Open them wide. Alright, stick your tongue out. Alright, close your mouth. Alright, try to open your eyes. There you go. Alright, from here, I want you to follow my pen. Keep your head still. Just move with your eyes, please. And in. Alright, can you cover one eye for me? We're going to be checking your peripheral vision. Just let me know when you see my hand.
Yeah. Right there.
Keep your eyes straight ahead.
Right there.
Okay, switch for me. Look straight
Right
ahead
there.
at me. Okay.
Right there.
Alright.
Right there.
Alright. Good. Let's check your ears. The ears seem to be well formed. No deformities noted. Have a detached earlobe here. The ear seems to be fine. Do you hear well?
Yes.
Okay, normally I would use a tuning fork to assess the Weber-Renee test, but we'll just use the whisper test since we don't have a tuning fork. So let me know what words you hear me say, okay?
Yes.
Spaghetti.
Spaghetti.
Alright.
Glasses.
Alright. He passed the whisper test. Could you raise your shoulders for me? Shrug your shoulders. Alright. Bring your ear to your shoulder. Other ear. Alright, turn your head from side to side. Alright, push against my hand. Good. Good. Good strength in the neck. We're going to palpate here. Going to palpate the lymph nodes. You just tell me if you have any pain or tenderness. Anything?
No.
Okay, going to check your thyroid. Alright. Even on both sides, no thyroid able to be palpated, which is normal. Okay, from here, I want to inspect your anterior and posterior chest. Could you remove your shirt for me, please? Alright, going to inspect the chest in the front. Could you stand and inspect the chest in the back as well? Checking the skin and it is appropriate. No lesions, small papules are present. Assessing to see the spine if it's midline, which it is. Checking for the symmetry in the raising as far as when it comes to him inhaling and exhaling, if it's appropriate, which it is. Okay, I will now listen to your breath sounds. Look for any adventitious sounds to see if it all sounds clear using the Z method. Every time you feel my stethoscope, just take a deep breath for me. Okay, good. No adventitious sounds. Everything sounds clear. We will percuss. Okay. I want you to say 99 or blue moon, whichever word you choose. Every time you feel my hand, go.
99. 99. 99. 99. 99. 99.
Alright, voice primitives is appropriate and it can be felt throughout. I'm going to check now to see if you have any tenderness. Any tenderness?
No.
Alright, no tenderness present in the CVA. You can turn around, sir, and have a seat. I'll look at you from the front here. I'm going to be inspecting your chest. I'm going to feel to see, palpate to see if we have any thrills or any heaves, and we don't have any tenderness here, sir?
No.
No tenderness, okay. Alright, gonna inspect your breast. Are you aware of how to do a self-breast exam?
Yes.
Okay, and it's important to always check under your arms as well for any lumps. Checking the lymph nodes in the axillary area. Switch sides, please. Alright, no lumps and the lymph nodes in that area either. Okay, from here I want to inspect your JVD, which is your jugular vein, for any distension. None noted. Okay, straight ahead for me. I will now palpate and auscultate your carotid to see if they're even on both sides. And palpable. They are palpable and +2. I will auscultate them now.
I know.
Pause real quick. Alright, I'll auscultate your carotid. Take a deep breath for me, hold it. Alright, breathe. Okay, it is present and +2 on the carotid. They're equal on both sides. Okay, from here I want to inspect your cardiac areas and palpate them as well, which I did before, but now I will auscultate them. I'll be auscultating the aorta area, the pulmonic area, Erb's point, the tricuspid, and the mitral. I will use my bell of my stethoscope to listen for any murmurs. The client has S1 and S2 present, no murmurs present. Locate the point of maximal impulse, which is usually right under the nipple, which it is. Alright, and it is palpable. I'm going to inspect the abdomen. I'm going to just look at it, generalize for any lesions. There are some striae present. There is hair in a diamond shape, which is appropriate for a male. From here, I will auscultate it. I'm listening for active bowel sounds. If they were inactive, I would listen for 15 seconds. If I didn't hear anything right away and they are all active and normal, I will percuss here. Alright, no dull areas present in this area. if I percuss on this side, it would be some minimal dullness. I'm going to do some light palpation, and you just tell me if there's any tenderness, okay?
Mm-hmm.
Do you have any tenderness, sir?
No.
Okay. I will do some deep palpation. Spleen. Alright, take a deep breath and hold it for me. Alright. Rigid area right at the edge of the liver. I'm going to try to palpate for the kidney. Alright, it is unpalpable, which is appropriate. Let's check for your abdominal reflexes. We're looking for any constricting. Alright, there is none present, which is expected. Okay, let's go with your extremities. We're going to be checking the extremities to check to see if you have good capillary refill. Checking your skin for warmth. Alright, can you grip my hands, please? Good. I'm going to check your pulses here. The radial pulse is present bilaterally and +2, as well as the brachial pulse. Could you hold your arms up? Alright, pull against me. Push against me. Okay, good. I will have you straighten your legs all the way out. Bend your knees. Checking for hip flexion. Any pain there?
No.
Okay. Legs out to me. Pull them in towards you. Push them out towards me. Okay, good. Push your feet up. Flex your toes. Push them down like you're pushing pedals. Okay, good. I'll check your femoral artery here. I'm going to go up your shorts here and also check for any palpable lymph nodes or nodules. None present. And checking for nodules. None present. Okay, checking the popliteal. Those pulses are +2 and present, both sides. Also going to check your posterior tibia. Present and +2. There's no edema either side. And dorsal pedal flexion. We'll check for cap refill. We have cap refill on 1, 2, 3, 4 out of the 10 toes here. Okay, from here, I want you to bring your heel down your shin on both sides. All right, good. Now, I want you to bring your fingers to your nose. Good, close your eyes. Do your fingers to your nose again. Okay, hands right on your, there you go. I want you to flip your hands in and out, as fast as you can. Okay, you can stop. Place your hand straight out in front of you. I'll place the object in your hand, you tell me what it is. Keep your eyes closed. What's the object?
Key.
Okay, and your other hand? Object?
Coin.
Thank you. You tell me if you feel sharp or soft, okay? On your extremities.
Sharp. Soft. Soft. Sharp.
Alright, the sterogenous and the sensory perception is in check. We'll check your Babinski side. Could you straighten your feet straight out flat towards me, just so I can get the ball of your feet. Just relax your feet. Try not to work against me. Okay. Alright. The Babinski sign is negative, which is appropriate. Now, could you stand for me, please? Close your eyes. I'm going to see what your balance is. Okay, could you stand on one foot for me? Alright, switch sides. Okay. Now just walk heel to toe, like a sobriety test. Okay. You can put your shirt back on now. Okay, the client appears to be healthy. His home setting appears to be appropriate with appropriate running water, feasible for him to be able to stay here with no problem. Do you have any questions?
No.
Do you have any new concerns or pain since you began?
No.
Okay. All right, well, thank you for your time. Thank you.